today?
Good.
Good. I'm Monica. I'll be your student nurse today. Can you tell me your name?
My name's Sam.
Okay, Sam. Nice to meet you. How are you feeling today? Overall health?
Pretty good. Yeah.
Good. No pain at all? Okay, great. And I just want you to remember my name for later. So, just from her parents' state of health, she said she's doing all right. Can you tell me your age?
I'm 21.
You're 21. Okay. And then your race?
Filipino. So Asian.
Filipino. Awesome. Okay. And gender, female. Could you tell me your height and your weight?
My height is 5'1" and my weight is 125.
Okay. And calculating that comes out to a 23.6 on the BMI chart, which that's healthy size, normal. Her dress and her grooming, and hygiene all looks appropriate. Her general demeanor is cooperative, her affect is animated, and her thought pattern is organized, logical, relevant, and her speech is articulate. And just from assessing her, her alertness is alert and oriented times 3, so she's doing well. Sam, could you tell me, once again, your name, your full name?
Maria Samantha Pangelino.
Awesome. And then could you tell me where you are?
I'm in the nursing hall of Egan.
Awesome. And then what time it is?
It's around 1.
Perfect. Yep. And then can you tell me why you're here?
Just for a comprehensive assessment.
Okay. Okay, great. And I just wanted to test your remote memory. Could you tell me who was the president before Joe Biden?
Donald Trump.
Awesome. And then can you tell me what my name is?
Monica.
Great. And then to test her abstract thinking, what does it mean to say, don't judge a book by its cover?
Don't judge someone off of their looks.
Great. And then just to test her judgment, if it was raining outside, like storming, what would you bring to prepare?
I would bring an umbrella, a raincoat, and boots.
Great. And now we're just going to take her vital sign. All right, and now we're just going to get her blood pressure. There we go. Would you hold that for me? Thank you. Okay, I had 98 over 58. Does that sound about right for you? Yeah? Okay. There you go. Thank you. Now we're just going to get your pulse ox right now. There you go. I'll just get your temperature while I'm at it. Let's go on this side. 98.1, that's appropriate. It's in the normal range. And then we have 98% pulse ox, that's also appropriate. And then I'm just gonna get your pulse real quick. Okay. Perfect. You have 90 beats per minute, and then you're at about 18 to 19 respirations. 19, I would say, respirations per minute. So all those are within normal ranges. And then what would you say your pain is at again? From a 0 being no pain at all to 10 being the worst pain?
0.
Okay, great. Okay, and then we're just going to assess the head, and upon looking at it, we see that the shape is normocephalic, it's symmetrical, I feel no bumps, I see no lesions or anything like that. Her hair is evenly distributed and fully attached, so everything looks appropriate. All right, and now we're just going to assess her eyes. Her eyes are properly aligned with her ears. I see no sinking in or bulging out of her eyes, any exop or enophthalmos. And now we're just going to test Perla, which will help us see if her cranial nerves 2 and 3 are properly functioning. So Sam, I'm just going to, if you could just look at the bridge of my nose, I'm going to shine this twice in both eyes to test. Okay. Okay, perfect. Appropriate pupillary constriction, and both were consensual, yes. Okay, but there was both consensual constriction and reaction to the light. I'm also now going to test her EOMs. This will see if cranial nerves 3, 4, and 6 are appropriately functioning. But I just need you to look at this pen light and just, oh, well, first I want to test her accommodation. So we're going to have her look, if you can look at something far away over there, and then once I tell you to just look at my pen light. Okay, go. Okay, perfect. Convergence was appropriate, and I can't see too well because of the lighting, but her constriction, I believe, would be appropriate. And then now we're going to test her EOMs. Just look at this and just follow the pen, but don't move your head. Okay, perfect. Her eyes moved appropriately and consensually. There was no nystagmus or anything present, so her cranial nerves are intact. Now we're just going to look at her ears, and we see that they're both symmetrical and appropriately positioned. I see no lumps, and I feel no lumps or lesions or anything present. We just have these earrings here. Her gross hearing is intact. Sorry about that. And now we're just going to look at her ears really quick to see if there's any of that inside, up, out, and back. I see no lesions, no redness, no drainage or anything like that. On the other side, if you could turn your head over this way, thank you. Up, out, and back. And again, no redness, drainage, lesions, anything of that sort. So her ears are appropriately intact. Now we're just going to look at your nose real quick. And Sam, do you have any difficulty breathing or congestion right now? No? Okay, do you have any difficulty smelling?
No.
No? Okay, we're just going to look at your nose real quick. Okay, perfect. And I see that her vestibules are properly the same size. I see no lesions. I see no redness or drainage or anything like that. And no deviated septum. Everything looks appropriate. And now we're just going to assess Sam's throat real quick. Sam, do you mind opening up your mouth and tilting your head back? Okay, go ahead and open up a little bit more. Okay, great. It is nice and pink. It's moist, it's intact. I see no abnormalities like lesions or redness, swelling, or anything like that. There is no missing teeth. There are no dentures I see. No bad odor, anything like that. If I was to check her gag reflex, I would use a tongue depressor and keep inching back until it triggers. And then, could you swallow for me? Okay, perfect. Do you have any difficulty swallowing or anything like that? No? Okay, great. Her trachea is appropriately aligned, midline in the middle of her neck, so that is good. And now we're just gonna palpate her lymph nodes to see. And do you feel any tenderness as I do this? No? Okay, this is the preauricular, postauricular, occipital. Then we have tonsillar, submandibular, submental. Okay, now we have superficial cervical. Here we go. Superficial cervical, posterior cervical, and then deep cervical. No tenderness or anything like that? Okay. And then we have supraclavicular. Okay, and I felt no palpable lymph nodes or anything like that, all appropriate findings. Then we're just going to palpate and auscultate her carotid, see if it's properly functioning. I'm just gonna like get into that groove right there. Okay, perfect. 3+, nice and strong, present. Okay, perfect. Same thing, bilaterally, nice, strong, present, 3+. Now we're just going to auscultate her carotids to see if there's any like bruits or any turbulence, anything like that present. Sam, if you could just breathe in deeply and then breathe out and then hold. Okay, go ahead. Go ahead and breathe. Okay, perfect. I heard no bruits or turbulence like that, anything present. It was appropriate sounding, and again, her pulse is nice and strong, 3+. Okay, so now we're just going to assess Sam's lungs and thorax. Just going to inspect and see her thorax is appropriate size, appropriate shape. Her shoulders are nice and symmetrical and even, as well as her clavicles. Can I palpate down your sternum? Okay, we're just gonna go right down here. Manubrium, nice and vertical, appropriate. And then just going to palpate across her ribs. Okay, appropriate and symmetrical. And now we're just going to, can I tuck this down a little bit? Just going to assess for any lesions. I see no lesions or anything or any deformities. All looks appropriate. If you could turn your head to the side and breathe deeply, but no quicker than normal. Just going to test your respiratory excursion. Now go right ahead. Okay, beautiful. Bilateral symmetry for both sides. All right, and now I'm just going to auscultate the anterior thorax. Okay, and if you could turn your head to the side once more and breathe deeply, but no quicker than normal. Just going to tuck and displace. Okay, once more. Okay, vesicular throughout. It was nice and easy, clear. I heard no adventitious breath sounds or anything abnormal like that. Okay, so now we are just going to inspect, auscultate, palpate her posterior thorax. So we're just going to look at the size of her thorax. It's the appropriate size and shape. Her shoulders are nice and symmetrical. We're going to now palpate the scapulae, and they are both symmetrical and appropriately situated. And then we're just going to palpate from the base of the skull. If you could turn your head down a little bit, all the way down to coccyx. Okay, perfect. It's properly aligned, indicating that there's no scoliosis or anything like that. Also, I see no, just assessing the skin, I see no abnormalities other than normal actinic lesions, so everything is appropriate here. Now we're just going to assess the S curvature of her spine. So just upon looking upon it, we have the appropriate concavity, convexity, concavity, and convexity, indicating that there's no lordosis or kyphosis present. We're also going to assess the AP to transverse diameter. And just from taking it right here to the side, we have the appropriate half AP of the transverse diameter, so that is an appropriate finding. Now we're just going to assess her respiratory excursion once more. If you could turn your head to the side and breathe deeply, but no quicker than normal, I'll let you know in just a moment. Okay, go right ahead. Perfect. She had bilateral symmetry, indicating that appropriate respiration excursion. And now we're just going to auscultate her lungs. And Sam, if you could just displace your shoulders by hugging yourself, and then breathe deeply, but no quicker than normal. Thank you. Okay, she had vesicular breath sounds all throughout. It was nice, clear, easy, non-labored, so all appropriate findings. Okay, we're just going to assess the heart portion for Sam here. And so starting off, I'm just going to look and inspect, and I see no pulsations coming through. Everything's appropriate. We're just now going to palpate for any pulsations or thrills. I've just found the angle of Louis. We're just going to go into that second intercostal space. Feel no pulsations, no thrills, just going right across. No pulsations, no thrills. Now going down to that third intercostal space. No pulsations, no thrills. Going down into that fourth intercostal space. No pulsations, no thrills. Now into that fifth intercostal space, that tricuspid. You know, right there, and that third part was, or the third spot was the Erb's point, but now we're in the fifth. There's no pulsations, no thrills. We're just gonna do a half step, or no, that's for the, that's for auscultation. And now, do you mind if I just displace a little bit? We're just going to palpate right here in the mid-clavicular line, fifth intercostal space. Present pulsations is negative for thrills. Yes. Okay, and now I'm just going to, okay, and for the PMI, I found that the location was appropriate. It was in that fifth intercostal space. The rate was consistent with vital signs. Rhythm was regular, intensity was strong. Her diameter was the appropriate size, was in that fifth intercostal space. I didn't feel any of the pulsations or thrills outside of that, and it was negative anyway for thrills. And then the duration was also appropriate. Okay, now we're just going to auscultate and listen to her heart and look for that appropriate relationship between S1 and S2. Okay, just gonna find again. Perfect. Just gonna go right across. Appropriate. S2 is heard louder. Appropriate. I'm gonna go down to Erb's point. To the fourth intercostal space. Just gonna go into that fifth intercostal space. Half step. And then, do you mind if I displace real quick? Thank you. Into that fifth intercostal space. Perfect. And there were appropriate sounds throughout. Her S2 was heard louder up at the apex of her heart, but it was heard louder. S1 was heard louder at the base of her heart. So all of her sounds were appropriate in relationship to each other. And now I'm just going to talk about their rate. So the rate as well, the rate was appropriate. It was consistent with vital signs. The rhythm was appropriate. It was regular. The strength was nice and strong, and I heard no extra heart sounds. And now just to assess the patient for any JVD, it's negative for JVD. We see no distension. We see normal pulsations going on here, but all this is appropriate. But there is no observable distension going on from here. All appropriate findings. Assess Sam's abdomen, and I'm just going to look from the side, and it is non-distended, so that's an appropriate finding, so there's no distension. We're just going to listen to her bowel sounds, and 5 to 34 is the normal range. Okay, she had about 22 sounds, so that is within the normal ranges. And now we're just going to percuss across her abdomen. Okay, and it was abdominal tympany throughout. At some points, it sounded a bit duller, but to be honest, I had like rustled against the clothing, so I think that affected it. But for the most part, and the appropriate finding, I did find abdominal tympany throughout. And now we're just going to palpate to see if there's any lumps or tenderness or anything like that. Let me know if you feel anything. Okay, felt no lumps, any tenderness? No, okay. See no lesions. And then I felt negative for organomegaly as well as any bladder distension or anything like that. So everything is appropriate. And then I just wanted to ask you, how are your bowel habits? Are you experiencing any accidents?
No.
No? Okay. What's the color of your stools?
Brown.
Okay. And then the consistency?
Pretty like, just, like normal stool.
Like soft and round?
Soft and, yeah.
Okay.
Round.
And then the amount?
Amount.
Like appropriate? Is
yeah,
it
it could be appropriate amount.
Okay.
I feel like whatever I eat usually comes out.
Okay,
Yeah.
perfect. And then the frequency?
Frequency, about like once a day.
Okay.
Yeah.
Okay. And then your last bowel movement?
This morning.
This morning. Okay, perfect. And then I'm just going to ask you about your genitourinary area. Is there any tenderness there? No. Lumps?
No.
Any lesions?
No.
Okay. And then your bladder habits. Are you experiencing any accidents?
No.
No. Okay. And then what's the color?
Color is like a straw color, so yellow, light yellow.
Okay, perfect. And is it clear?
Yeah, it's clear.
Okay. And then is the amount the appropriate amount? Is it quantity sufficient or?
Yeah, whatever I drink that goes in comes out.
Okay, perfect. Okay, and now we're going to move on to the musculoskeletal assessment. Anna, thank you so much for helping me do this. I just want to ask you, are you experiencing any joint pain at all?
Nope.
No. I don't see any deformities or anything like that present. Everything looks appropriate. How's your range of motion? Any problems with that?
Nope.
Inability? Nope. Okay. And then are you experiencing any like snap, crackling, or popping of the joints? Nope. Okay. And so that's negative for crepitus. We are just going to assess the extremities now. Just looking at the color, everything looks to be of an appropriate flesh tone. It's nice and warm. Just look at your arms as well. Nice and warm, appropriate flesh tone. And then we're just going to assess her pulses, if you could. Okay, her pulses radial are strong, 3+ symmetrical. They're present. I'm just gonna check her brachials. Beautiful, strong, 3+ symmetrical. They are present. Now we're just going to go down to her dorsalis pedis. Okay, there you go. Strong, 3+. They are present, symmetrical. Now we're just going to go to her posterior tibial. I always have a harder time finding this one. Okay, strong, 3+, present. Everything is appropriate findings. I'm just going to assess her capillary refill now. Great, pinks up in less than 2 seconds. Oh, wrong finger. Perfect. All right, all appropriate. Brisk capillary refill. Now we're going to go down to her toes. Brisk, less than 2 seconds. Brisk. Brisk, awesome. And she is negative for edema. I don't see any edematous. All right, now we're just going to assess her neurological, we're going to conduct the neurological assessment. We're going to see her strength and symmetry. If you could just grab onto here, you can pull, push. Beautiful, nice and strong, strengths out of 5. And can you just push up against my feet, my hands? Push down. Okay, and now push forward. Now push back. Beautiful, proper strength. Strengths out of 5. And now I just like to assess your coordination. Could you go ahead and walk right over here? Okay, great. Appropriate coordination. All normal findings. And then I'm just going to test your deep tendon reflexes. Okay. Thank you so much. Okay, that's about a 2. Ooh, 3. Okay, let's see if we can get a 3 out of this one. Okay, 3. High normal. That's appropriate. And then let's do your triceps reflex. Just like that. You just rest on there. Wait. Oh, okay. That's about a 2, I would say. Normal. Okay. Just rest your hand. Okay, beautiful. Whoa, that was like about 2 to 3. So that's appropriate. And then just to test your short-term memory, can you remember my name?
Monica.
Great. Thank you so much, Anna. I appreciate that. Concludes our assessment. Just to quickly address some of the things in the video, when I was testing her alertness in the beginning, I meant to say at a level 5, and later on when I asked her where she was, why, etc., that was at A&O times 3. I meant to say that her S2 was heard louder at the base of her heart, and that S1 was heard louder at the apex. I keep switching that up. And then for pulsations and throws for that PMI spot, I think I was just a little closer to the midline rather than midclavicular. Just wanted to address that as well. And I kept missing to say midclavicular when I was looking at that spot. And because of clothing, the comfort of the volunteer wasn't able to show on camera any lesions or anything like that, but that was negative for that as well as all appropriate findings. And then for testing her strength, I forgot to assess like her grip on my fingers, but that was appropriate as well.